Hey everyone, welcome back to Trove Direct. Uterine cancer is quietly becoming one of the most pressing health threats for women in the United States. Unlike other cancers, both its incidence and death rates are rising, signaling a failure in our current prevention and treatment strategies. The crisis is especially severe for Black women, who face higher rates of aggressive disease and mortality. This disparity is not new, but it's worsening, making it a matter of urgent health equity. Behind the numbers are real women, mothers, daughters, sisters, whose lives are at risk. The American Cancer Society calls the projected increases alarming, underscoring the need for immediate action. We're at a crossroads. Will we act to change this trajectory, or let these grim predictions become reality? The challenge is complex, involving biology, access to care, and systemic inequities. To make progress, we must understand the drivers behind rising cases and the racial gap in outcomes. Our response must be bold, targeted, and rooted in a commitment to health justice. By 2050, new uterine cancer cases in the US are projected to jump 50%, from 66,000 to 122,000 annually. Even more troubling, deaths are expected to rise 75%, reaching nearly 20,000 women each year. This surge means uterine cancer will become an even greater threat to women's health. Black women will bear a disproportionate burden, accounting for 18% of deaths, despite being a smaller share of the population. They are already twice as likely to die from this cancer as women of other backgrounds, a gap that's only widening. These numbers aren't just statistics. They reflect deep, systemic failures in our healthcare system. The data is a call to action. We must address why this cancer is bucking the trend and why Black women are most at risk. Ignoring these projections would be a preventable tragedy. The time to act is now, before these numbers become reality. Black women face higher risk from uterine cancer due to a mix of biology, bias, and barriers to care. They're more likely to develop aggressive subtypes that respond poorly to standard treatments. Delayed diagnosis is common. Symptoms like abnormal bleeding are too often dismissed or misdiagnosed. Implicit bias in healthcare means Black women's concerns aren't always taken seriously, leading to later stage diagnoses. Many lack access to high-quality care or live in areas without specialized cancer centers. Higher rates of obesity, diabetes, and hypertension, driven by systemic inequities, further increase risk and complicate treatment. These factors combine to create a dangerous survival gap. The disparity in outcomes is a direct reflection of broader social and healthcare inequities. Experts are sounding the alarm and demanding urgent action to reverse these trends. Dr. Karen Knudsen of the American Cancer Society calls for a major boost in research funding, especially for aggressive subtypes affecting Black women. Dr. Kemi Dole stresses that we can't solve this crisis without tackling its root causes, both medical and systemic. There's no routine screening for uterine cancer, so new early detection strategies are desperately needed. Policies must ensure equitable access to high-quality care, regardless of race or income. Initiatives like implicit bias training, expanding insurance, and patient navigation programs can help close the gap. Collaboration between researchers, communities, and public health agencies is essential. We must hold healthcare systems accountable for equitable outcomes. The roadmap is clear. What's needed now is the will to act. The future of thousands of women depends on it. Awareness is the best defense against uterine cancer, since there's no routine screening. The most important symptom is abnormal vaginal bleeding, especially after menopause or between periods. Other warning signs include pelvic pain, pressure, pain during sex, or unusual discharge. Don't ignore changes. Prompt medical attention can save lives. We need public campaigns to educate women, especially Black women, about symptoms and empower them to advocate for their health. Community organizations play a vital role in spreading this information and supporting women through the healthcare system. Reversing this crisis requires both individual vigilance and systemic change. We must demand more research, better treatments, and fair care for every woman. The projections for 2050 are a warning, but with action, we can change the future of uterine cancer. Don't forget to like, subscribe, and share the video with anyone you think it might help.